treatment of breast cancer involves multiple different specialists. Breast cancer treatment involves multiple modalities. The surgery of the breast cancer is usually the first treatment, and obviously that's done by a surgeon. Oftentimes it should be done by a breast surgeon who's experienced in the treatment of breast cancer. And then obviously you need the other specialists that are involved. So if you look at the treatments are surgery that's done by a surgeon, hormonal therapy and or chemotherapy. The person who's going to be treating that situation is your medical oncologist. And then we look at the radiation treatment. Radiation treatment may be done after surgery, and the person doing your radiation is going to be your radiation oncologist. So all these different treatments are handled by different specialists who do that all the time. Oftentimes, if you were going to be doing a mastectomy and reconstruction, the general surgeon or breast surgeon will be doing a mastectomy, and you need to have a plastic surgeon to do your reconstruction. So, we think about the treatment of breast cancer as a multimodality problem which needs multiple specialists. So, as part of the Kristen Hoke Breast Program at Jupiter, we've assembled a team of multiple different specialists. So we have surgeons, medical oncologists, radiation oncologists, and plastic surgeons who are all experienced in looking after these problems. Once a patient comes into the system, oftentimes they come into the system first through the general or breast surgeon. So oftentimes he's the gatekeeper or the first person who's really explaining the situation to the patient for the first time. And at that point we really start to open up and spread the patient so that she can be seeing multiple different specialists. As part of the Kristen Hoke program at Jupiter Medical Center, we have our breast navigator. So the concept of a navigator is relatively new. It's been around for a few years. The nurse navigator is a nurse who's trained in helping the patient and often facilitating these different appointments. So, it can be a situation that's quite difficult in terms of making all these appointments and going to see the different specialists. And really it's an education process where we explain everything to the patient. Oftentimes before surgery, in my opinion, a patient is better off knowing as much as possible before her surgery so she understands all the terms and all the options, so that her choice of surgery, which is usually the first treatment, is a good decision that she feels comfortable with going through the whole process. So, to go from diagnosis to completing treatment can take many months, sometimes a year, and involves multiple visits to multiple specialists because they're the people who are going to be looking after the patient. Surgery is not the only treatment for breast cancer. Breast cancer diagnosis is complicated and involves multiple different specialists, and we have all those treatment options available, and we use them every week.